Anthropologists of global health have shown how epidemics attack social bonds as well as cells. In examples from HIV to Ebola, from the 1918 flu pandemic to cholera outbreaks in the 1830s, lessons from global health history show how epidemics flourish in and produce conditions of mistrust, unfairness, and blame. Yet these examples also show that these outcomes are not inevitable. In all these cases, efforts to democratize public health, foster equality, and support the everyday efforts of people to protect themselves and care for others proved potent public health tools, flattening the curve, so to speak, even when technological solutions remained out of reach. In some cases, social responses generated health outcomes that far exceeded pessimistic projections. One of the defining features of COVID-19 has been how many of us have come to rely on epidemiological language, like flattening the curve, to make sense of our experience. But global health examples suggest that individual experiences of equality and care, or division and blame, are as important as vaccines in determining possibilities for future health.